This video is a powerful reminder of the extraordinary industries that call Oregon home. For a state representing about 1% of the US population, we clearly punch above our weight. From our beautiful environment, we serve as global leaders. Over the past 3 summits, we have highlighted opportunities in several of these sectors: semiconductors, food and beverage, and clean technology. This morning, we will broaden that lens and spotlight industries that are poised for growth and show how strengthening our connection with Oregon's universities can accelerate innovation, especially when that work is integrated with our communities and the broader educational pipeline. To launch this segment, I'm delighted to welcome Dr. Shereef Elnahal, President of OHSU. Dr. Elnahal is a recent arrival to Oregon, having been here just a little bit over 3 months. We are extraordinarily fortunate that he has chosen to make this state his home. With young children in our schools, he is putting down roots, and we are lucky to have him. When it comes to advancing innovation at OHSU, I cannot imagine a better leader to guide that work. Please welcome Dr. Shereef Elnahal.
Good morning, everyone. I am so pleased to be here and to interact with Oregon's incredibly vibrant business community, despite the challenges that we heard this morning, is my great honor. And it's my opportunity to convince all of you that I believe, as the new guy on the block here in Oregon, that this can be one of the most important hubs for biomedical innovation in the United States and in the entire globe. Now, my impression, besides the opportunity to enjoy the incredible natural beauty with my family just over the summer before I started on August 11th, one of my first impressions of this state was how a state of just over 4 million people could have had such an extraordinary impact on multiple industries and multiple different ways that Americans interact with each other and with the world coming out of this state. And sometimes it just requires the new person to remind everybody about the outsized impact that this state has had over many years, despite some of the more recent challenges. Obviously, in high tech, between Intel and Tektronix, semiconductors, we've done incredible things in this state over time. Dovetailing into footwear and apparel, there is no state that punches above its weight more than this one between Nike, Adidas, Columbia, and beyond. When it comes to advanced manufacturing, the really important areas of technology have had such an outsized and important impact across the globe. Forestry and wood products, not only addressing the important housing issues we've had in this state, but also doing it in a way that respects the climate change agenda and ultimately helps us get to a better place with that very important policy world. Business services, Wyden and Kennedy, who helped us get the word out about the incredible $2 billion philanthropic investment that Phil and Penny Knight made in OHSU. OHSU is Oregon's academic health center, an extraordinary investment in Oregon, and you'll hear from Dr. Brian Drucker in just a few minutes about that. And of course, food and beverage. Can't get a better Pinot Noir, in my opinion, than right here in the state of Oregon. And so just remembering that incredible legacy, again, of outsized contribution to the country, dovetails into the most important next target industry for this state, which is biosciences. Just in 2023, $11.5 billion of economic output, 28,000 high-paying jobs that average at $100,000 a year, more than 50% higher than Oregon's overall salary average. This is an industry that can and will thrive in this state and create a new economic future for Oregonians and people across the country who want and will ultimately want to move here. And part of my story in telling you about why I am so confident in this state starts with OHSU's story, which in the mid-1980s was a small public hospital and was on the verge of closing. This was actually a debate that was happening in the legislature because it was described as a place that was too small, the quality of care was too poor, and it was only a place where folks who couldn't afford to get other health care had to go. Then came one of my predecessors, Dr. Pete Kohler, with whom I had a chance to have a conversation just last week reflecting on his legacy, who said, no, this will not just be a local public hospital, it will be a top 20 academic health center in the United States. And guess what? By the time he left in the early 2000s, he achieved that by very close and meaningful collaboration, not just with the government, which is extremely important, a supportive governor, a supportive legislator, supportive local governments who said, we are with you on this vision, but very importantly, with the local business community here in Oregon. And that really culminated into the next president's amazing venture with the tram, which is now emblematic and iconic, so really projecting the image of Portland across the country, but wasn't easy and frankly was quite controversial when it was first introduced in the early 2000s as an idea. There was massive opposition to this. Folks thought it would be unsightly, folks thought it would be a violation of privacy, and folks thought it would fail. But now it serves as the main connector between our two campuses on Markham Hill, where it started, and a growing South Waterfront that is now a major part of the economic engine in Portland. And remember, this was the initial reaction. Folks thought that this would be a bad idea, that it would be too amenable and servile to corporate interests and business interests and not the interests of the city. And now it is one of the most popular tourist destinations within the city of Portland and across Oregon. And that ultimately allowed us to grow our really important footprint on the South Waterfront. Now a major part of our ambulatory care operation is there. A lot of our cancer care out of the Knight Cancer Institute is there, across many other important specialties. But this also was not an effort that could be taken for granted. Dr. Joe Robertson, may he rest in peace, just had a chance to celebrate his life at OHSU and of course his beautiful memorial here in Portland, was a pioneer in thinking outside the box in trying to make this happen. The Center for Health and Healing is now one of our most important buildings, but it didn't happen by accident. We actually had a situation at OHSU with low to no deck capacity after construction of the tram, the Kohler Pavilion, and other parts of our campus. But at the time, the physician practice plan was a separate 501c3, and he went to those physicians and said, please help us own this building, raise the debt, and you will feel ownership and help us expand our footprint across the state. And we were able to do that with that creative thinking. Again, punching above our weight as an institution and as a state. And this is the difference between that kind of thinking in 2003 when Joe just took office at OHSU. Not as pretty of a set of buildings as you see in the 2025 picture, but as you can see, the Vista Pavilion, which is this big V-shaped building, didn't exist then, but it exists now and it will open in April, entirely dedicated to patients with cancer as a result of the Knight family's $2 billion investment in OHSU. 128 beds, hundreds of new jobs, and very importantly, a chance to create a cancer experience that is unparalleled and frankly redefine the experience of what patients can expect to get, holding their hands and bringing their families and support network along with the most devastating piece of news that an individual or a family can get. That is the vision, and we will accomplish it because we're not only optimistic about what we can do here in the state of Oregon, we're optimistic about the footprint we can make nationally with this historic effort. And so Dr. Charles Dodder is an example of somebody who literally invented a field of medicine, interventional radiology, happened right here at OHSU, international impact. Dr. Albert Starr invented the first artificial heart valve, now used across the world to treat cardiovascular and valvular disease. Dr. David Wong invented the gold standard technology that is used by every ophthalmologist and anybody examining somebody's retina in the eye to diagnose and treat eye disease. That was invented here in Oregon and at OHSU. And finally, you'll hear from Dr. Brian Drucker in just a few moments, the inventor of Gleevec, which made chronic myelogenous leukemia a 3 to 5 year prognosis to a normal lifespan. These are the kinds of innovations that I know are possible here because we've done it. And we can scale them across the world after investing in our business community and in our mission here at OHSU. Now, we can talk all day about some of the evolution of the American healthcare system and why it's made innovation harder and harder over time. The government has had to, in an effort to expand access and outcomes to the poorest people in America, we've relied more and more upon federal and state resources to make that happen. And that has constrained our ability to innovate. It has constrained our ability to ultimately finance our efforts when we're in an unprecedented era where both federal and state resources are scant. And so it's in our economic interest at OHSU, but also across our healthcare system, to figure out other ways that we can ultimately support and subsidize and sustain these excellent healthcare outcomes and ultimately create a new innovation economy around healthcare, digital health, biotech, and drug development right here in Oregon. And so we're in this interesting state where we're a hybrid public and private system, and we're a world leader in innovation, but ultimately we have uneven outcomes for people across the country. And traditional sources of funding are at risk to be able to make our vision happen at OHSU. So what I like to draw upon is Stephen Johnson's quote about where good ideas come from. It's a great book. If you haven't picked it up, I highly recommend it. And this quote is very apropos for what our vision can be here in Oregon for the biomedical sector. When ideas take form in this hunch state, they need to collide with other hunches. Oftentimes, the thing that turns a hunch into a real breakthrough is another hunch that is lurking in somebody else's mind. And you have to figure out a way to create systems that allow those hunches to come together and create something bigger than the sum of their parts. The point is that OHSU cannot do this alone. OHSU can be a catalyst for a new innovation economy in healthcare, digital health, and beyond. But what it requires is that we work together as a business community, other health systems, our payer community, and our business community to create that ecosystem from the ground up. Silicon Valley, I don't need to explain how that has made outsized economic impact in the Bay Area and California. Boston has the Route 128 Tech Corridor, a biotech hub, and the Broad Institute, which drew out of the Human Genome Project, which mapped human DNA for the first time and is now contributing outsized scientific and innovations across the country. And the North Carolina Research Triangle, combining 3 universities and state policy to create an entirely new hub for healthcare innovation in North Carolina. We can think about ways to combine our talent, but also to be diligent and meaningful about policy development, working with the governor and the legislature and with our congressional delegation to understand what that ecosystem can look like and plan for it in advance and execute on it together. At OHSU, we're happy to have and maintain some of the best policy minds in the state, but also some of the best innovators in the state that are ready and willing to work with a new ecosystem of investors and innovators and businesses who will benefit from us becoming the next biotech and healthcare innovation hub for the United States. And so my invitation to all of you is to work with us on our new vision for OHSU. OHSU has clearly made an extraordinary impact on the state. We have many partners, our sister health systems, our other healthcare innovators, our collaborative care organizations. We have done a lot to make this an excellent place to get healthcare, but also to contribute to innovations that have impacted not just the nation, but the world. It is my hypothesis and my strong belief that if we work together to plan this out diligently and we form those partnerships, we can create the next hub for healthcare innovation in the United States. And that will require us to think holistically and to think collaboratively about not who gets what of the smaller pie of government funding or subsidies, but how we can create value and how we can scale that value first and principally to benefit Oregonians, but then how we can offer that global talent and those innovations to the entire globe. I believe we can do this with partnerships with all of you, and I very much look forward to doing that. Thank you so much for your time this morning. I appreciate you all very much.
That's great.